bicuspid aortic valve has two flaps instead of three. So typically a patient would be born with a tricuspid valve, meaning they have three flaps that make up their aortic valve. If you're born with a bicuspid aortic valve, it can tend to wear out over time. So we see patients typically in their 40s or 50s who maybe come in with a leaky heart valve or a stenotic heart valve, meaning that the valve starts to become calcified and less pliable and thickened, and then it prevents blood from easily leaving the heart. The flow through the valve is abnormal. So if you pictured a faucet and water coming out of your faucet, it comes out what we call laminar flow. It comes out kind of straight in an organized fashion. But even if you were to take your finger and just put it slightly into the stream, what would happen? You'd have chaos. There's water splashed everywhere. It's the same thing with a bicuspid aortic valve. So your aortic root is specially designed to have nice, clear laminar flow through it. With two flaps instead of three, there's always a little bit of obstruction to the flow. That chaos results in stress and strain in the aortic wall, which may result in a patient's aorta enlarging over time.
Let's take a look at this patient now with respect to his aortic valve. We'll start with the parasternal long axis view. And we can appreciate that the patient has a mildly thickened aortic valve, but there are no calcifications. But we also see that the motion of the aortic valve is abnormal. There is doming of the aortic valve. Here in systole, there's doming of the valve. And in addition, the ascending aorta is also dilated. So this together with the morphology of the valve is almost indicative of a bicuspid aortic valve.
It has three leaflets to it, but with a bicuspid valve there are only two leaflets, and these two leaflets then can cause problems. Now, the importance of the aortic valve is that it sits between the aorta, the big tube that comes out of the heart, and the heart pumping chamber, the main pumping chamber, and so it controls and stops blood flowing back into the pump. Works so much harder, and the result is that the heart is running like a marathon in there, working so much harder either against an increased gradient, the narrowing of the valve, or because of the extra load of blood flowing back to the heart. Now the symptoms vary according to what type of pathology is present. So when the valve narrows down and causes aortic valve stenosis, the heart has to pump harder against it, so the heart typically initially develops more muscle. The symptoms that are associated with that is that patients can have chest pain, they can develop